The biggest mistake I see people make with peptides is skipping the safety part. They jump straight to what to buy instead of asking what they should ask. So in the next few minutes, I'll show you how to research peptides responsibly. Quick disclaimer, this is general education, not personal medical advice. I'm not telling you what to take or how to dose anything. My goal is to give you a simple framework you can use to help evaluate what you're seeing online and what questions you should ask before you start anything. So why are peptides confusing? The word peptide is a huge umbrella. Some peptides are naturally occurring amino acid sequences your body recognizes. Some are used in medicine in very specific ways. And then there's a lot of online content that mixes personal experience, education, and marketing. So it's hard to know what's credible, what's exaggerated, and what simply is not the right fit for you. So instead of getting lost in the noise, I want to give you a common sense checklist. Because the goal is not hype, the goal is outcomes done responsibly. Number one, if you can't clearly identify what the compound is and what it's intended to support, slow down. Online, the word peptide can turn into a buzzword, so you want to know exactly what you're taking and why. If the explanation is vague, that's not a small issue, because in medicine, vague usually means we don't have enough clarity to make a safe decision. You should be able to leave that conversation knowing the name of the peptide and what it's designed to support. Number two, if there's no real plan, that's a sign to take a step back. Peptides shouldn't be, here you go, good luck. You should know the timeline, what we're tracking, when we reassess, and what would make us adjust or stop. If nobody can explain what follow-up looks like, don't rush it, get clarity first. Number three, if it's a blend and they can't clearly explain what's inside and why it's combined, be cautious. You should be able to ask, what are the exact ingredients and why are we mixing them together? In medicine, you should never be guessing. Now let's flip it. If you're trying to figure out what responsible peptide care looks like, here are the green flags I'd look for. Number one, there's a real conversation about you, your goals, your health history, what you've tried before, and what you're actually trying to improve. Number two, the provider can explain the why clearly. Not just this is popular, but why that specific approach makes sense for your specific goals. Number three, there's a plan and it's structured. You know what you're starting, what the timeline looks like, and what the next step is. Number four, there's follow-up. You're not left guessing. You know who's checking in, when you're reassessing, and what would prompt readjustments. And number five, one of the biggest green flags is a provider who's comfortable saying, not yet, not for you. Let's start with something simpler first. That's not a rejection, that's responsible medicine. So here's the takeaway. Peptides can be useful tools, but the safest lane is always the same. Know what you're using, have a real plan, and make sure there's follow-up. If you want part two, let me know in the comments. Tell me the top peptide topics you want me to cover. Sleep, recovery, metabolism, or skin, and we'll break them down one by one. Like the video, subscribe, and I'll see you next time.